Well, it happened right around Christmas Eve. I was not feeling well. Matter of fact, I was feeling terrible.
I took her temperature. It was getting close to 5 o'clock, and it was 104. And I called the immediate care, and they were about to close, and they said go to the emergency room. Pretty stubborn about these things, and I said, if you don't respond, I'm calling 911, and I figured that would get her to talk, and she didn't. They got here, we talked about what to do, they took some tests, and they recommended taking her to the hospital.
And all of this is very hazy. I know they admitted me, and I remember getting to the room, and they were still doing tests, waiting for the test results, and they finally diagnosed it as a kidney infection that had turned to sepsis. And I guess I had a kidney stone, but I had no symptoms of a kidney stone. Everyone says, oh, they're so painful. I never felt anything. The following week, when I went over to the outpatient, they were able to do that shock therapy, so I didn't have to have the surgery. And I'll tell you, the people there, well, at both places, they were just so kind and so considerate and so helpful and so understanding, and wanted to make sure that I was comfortable and anything that I needed, etc., etc. And that whole procedure, it was a piece of cake. It was able to break up the stone enough that I was able to pass it without any problems.
Yeah, and I was really impressed with the center also. I had never heard of it before we had gone there. And from the moment you walk in on, okay, what do I do? Where do I go? How do I check in? This is what we're here for. Everybody was just so helpful, so courteous. It just seemed that when they walked in the room, whether it was a doctor, a nurse, or one of the staff, that was the only thing that they had to do right then and there, was to take care of Bernie.